So we see this a lot in the medical world today. And so a lot of patients who don't have an established primary care doctor are not getting the best treatment for their chronic medical conditions and health illnesses that they do have. So what happens is they're jumping from doctor to doctor or not seeing a doctor often enough. And so often what I see is people with advanced diseases that come in, it's too late. Primary care is the foundation of healthcare, and a primary care physician, also known as a PCP, is usually a first line of contact in the medical industry and the healthcare field. They usually coordinate care with your consultants and specialists. They do routine checks, annual physical exams, and even control and manage your chronic medical conditions. That's a great question. I don't think in life they really go over, the details on like when and where not to see a PCP. I don't think there is ever a wrong time to see a primary care doctor, but ideally when you're not sick. It's important to see a primary care doctor early on when you're not sick to establish that relationship and get your medical history. So a doctor who knows your history well can do an individualized plan in the event something does go wrong in the future. But ultimately, anytime's a good time. Just when you're not sick is the ideal time. So a primary care doctor or a PCP can help manage your healthcare by doing many things like routine annual checks, annual physical exams, managing and diagnosing chronic medical illnesses. They also coordinate care with all your specialists. We also deal with like mental wellness, lifestyle modifications, weight loss, things at large that affect your whole body and your well-being from head to toe. So my personal background and training is internal medicine. And so the biggest difference I would say between the two fields, between family medicine and internal medicine, primarily comes down to age group. And so my scope of practice in internal medicine is dealing with adults 18 years up to seniors, whereas a family medicine doctor sees newborns to seniors. And so that's the main stark difference, I would say, is whether you're not above 18 or are you below 18 years of age. And that kind of determines who you can see. Other than that, if you're above 18, you can see an internal medicine doctor or a family medicine doctor. I think they're both great physicians for you to see. So we see this a lot in the medical world today. And so a lot of patients who don't have an established primary care doctor are not getting the best treatment for their chronic medical conditions and health illnesses that they do have. So what happens is they're jumping from doctor to doctor or not seeing a doctor often enough. And so they're getting annual labs missed. They're not getting annual physical exams. They're not getting routine checks for screenings like colon cancer screenings and other cancer screenings. And often what I see is people with advanced diseases that come in, it's too late. Like, they didn't have a colonoscopy for the last 20 years and they have stage 4 colon cancer. Advanced medical therapies are coming out every single day, and with the way the medical world is heading towards, we are curing more and more diseases. So nowadays, the preventative screenings are becoming more and more important because with advanced therapies, we're able to actually help and cure more people, but we need to know what's going on. So if we don't know what's going on, we can't help you. So getting established with a primary care doctor and getting these routine screenings and annual exams is quite important.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.